A few housekeeping rules. Mona will mute all the mics when we're not speaking to prevent any feedback. We're going to record today's event. If you want to ask questions, then if you can either use the chat and raise the hands. We're going to get straight into it because we don't have much time today. Mona, if you could just show the presentation, the slide as the background, that would be useful. And while you're doing that, we've actually had great interest in today's meeting with 120 people registered and other people joining. Mona, can we have the slide?
Yes, I thought you actually already had it. I'm resharing it now. So
all right, lovely. So essentially the publication that we're launching today is making the case that the crisis is a moment of opportunity to expand and to strengthen social protection mechanisms. We know that the COVID-19 pandemic has affected all countries, but the risk of infection and the social and economic shocks of containment measures have highlighted and compounded existing vulnerabilities across society in every country in Europe and Central Asia. And what that means is for many people who are already falling behind due to poor health and poverty before COVID, the impact of the shocks is much higher and the risk of exclusion greater. So today's publication is designed to provide practical inspiration on what we can do, what we've learned from the past, and the value of social and health protection in building back better and leaving no one behind. The publication is available on the UNECE website in both English and in Russian. And I'm going to now go straight into introducing our first of our three regional directors, the three regional directors from WHO, UNICEF and ILO, who are the collaborating agencies on this publication. So I am delighted to introduce to you Dr. Hans Kluge. He's currently the WHO Regional Director for Europe. His term began on the 1st of February this year, and following his nomination by the WHO Regional Committee for Europe and appointment by the WHO Executive Board. Throughout the whole of his career, he has been committed to achieving better health for all with a focus on reducing vulnerability. And his career spans as a family doctor in Belgium, along a journey to Somalia, Liberia, prisons in Siberia, former Soviet Union countries, Myanmar, and the Democratic People's Republic of Korea. Most recently, before taking up post as regional director, he led the Division of Health Systems and Public Health at WHO Euro for more than a decade, and really was instrumental in the work around health systems for prosperity and solidarity. As regional director, Hans has brought in a new vision for the Regional Office for Europe, United Action for Better Health, working in partnership to achieve universal health coverage, address health emergencies, and promote health for populations. Hans, over to you.
Thank you so much, Chris. Do you hear me?
Perfectly.
And it's great to see Afshan and the colleagues are these from the UN agencies. I'm speaking here from Gaziantep. It's a very, let's say, significant day because the United Nations Security Council is debating today on the UN Security Council resolution on the cross-border operations. And we're going to have some supplies into northwest Syria a little bit later. So we're in full action here, but I had told Chris that we would definitely make everything possible to be part of this session, which I really appreciate. And thank you everyone for making it happening. So surely this group does not need reminding that we are really living in a very unprecedented time, one whose effects will be long-lasting and felt across the society. So in the face of such overwhelming health and socio-economic challenges, right, we remember that every crisis holds the seeds of opportunity for a better future. But of course, it does not diminish the challenges or make them any easier. So I thought to convey 3 points. The first one is that we must learn from the mistakes of the past and recognize that any responsible recovery plan should include investments in health, well-being and social protection. Number one. Number two, to have the boldness of vision to look beyond simply rebuilding the economy and society we had before. And third, finally, we as the UN agencies to engage fully in the efforts to support the countries to secure health and social sectors and institutions together to leave no one behind. So on the first one, about the mistakes in the past, across the European region, we have already seen countries adopt large-scale public health measures in order to control the spread of the disease, reduce the risk of infection, and improve medical care for those who fall ill and minimize the death toll. And as I'm sitting in Turkey, I would like to express my appreciation also to the Ministry of Health, Dr. Fatih Koca, because yesterday we signed an agreement to open a regional office in Istanbul on emergency preparedness, which will further help in rebuilding this future. As governments consider all the options for how to recover from this pandemic, I would like to emphasize a critical point. The best way to protect the economy and cohesion of our cities and countries is to protect the people and prevent the widening of inequities. And a lot of credit here to Chris and her team, who have been working with all of you very hard on that one. We are also trying to avoid some mistakes from the past. After the economic crisis in 2008, we tried to put health at the political agenda, but still we only came that far because we are looking particularly from the health side. So next week I'm going to announce the Monti Commission. It's a commission which will be chaired by President of the Bocconi University, President Monti, who used to be a commissioner and Prime Minister of Italy, with 12 commissioners, thinking how society is changing after the COVID and what does it mean for health and social resilience. And I will be very happy to engage all of us. Second message, the policy paper that we gathered today is to launch and explore the role of social protection as a measure to cope with the health and economic consequences of the COVID-19 across the region. And from a health perspective, we thought with Chris that to point out in ensuring social protection that there may be two important outcomes. One, through financial health protection, and individuals have access to health services. And second, social policies and labor market policies to ensure that health-related goods and services are accessible and affordable to all, including housing, water, sanitation, food security. And there we have to count really on all of your agencies because you have a very significant role over there. Social protection plays a critical role in reducing the social exclusion and thereby contributing to create trust, cohesion and solidarity. We have a consultation next week with the UN agencies on the European Programme of Work, which is the vision of health for the next 5 years. And it really is based on tackling root causes of the erosion of societal trust towards the health leadership. We are very concerned about this. At WHO, we would like to imagine this new European economy as an economy of well-being. And by this we mean an economy that puts the people in the center, provides a safety net for everyone, contributes to environmental sustainability, and where public health is seen as a safeguard of livelihoods. What we're trying to do now, when we assist countries who are lifting the lockdowns, like Turkey, is not to pitch health against the economy. It's not health or economy, right? Or Minister of Health against Prime Minister. There is no health, there is no economy. And the third point then is that the policy paper, which I know is a collaborative effort between the UN agencies, and I would like to thank so much all the UN brothers and sisters, that this is in the context of the UN issue-based coalition for social protection, and that it does not merely make the case for countries taking a more proactive role in expanding social protection, but also challenges us to step up and become more deeply involved in this effort. And I'm going to try to do the same from our side, because we know that the crisis has led bare the deep inequalities that exist within society in new and disturbing ways. It's our collective commitment to leave no one behind. And there again, I'm reaching out to everyone. Very good example again we're facing here. Yesterday, there information reports of the first COVID-19 case in Northwest Syria. This is something very difficult to reach. So only if we work together and with all of you, this is something that we can reach the last unreached person, really. So I will finish and say that in this moment of crisis, I am so grateful to stand shoulder to shoulder with all of the fellow UN agencies and to unite in action to protect health, well-being and livelihoods. The policy paper clearly lays out our shared commitment, and I look very much forward to using this as a practical inspiration for our continued action and joint efforts in this vital work of ensuring social protection. Thank you so much, Chris, and every one of you to give me this fantastic opportunity. Thank you.
Many thanks, Hans, and always inspiring as ever and rooted in practicality and what's happening on the ground. So thank you very much for that. I think that sets a very nice tone for me then to now kindly introduce Mr. Heinz Kohler. Heinz was appointed Assistant Director General and Regional Director for Europe and Central Asia, ILO. He's particularly in charge of supporting the ratification and implementation of international labour and social standards. And within that, particularly the ILO core conventions and fundamental principles and rights at work, and promoting the ILO decent work agenda, which is important to say is in cooperation with ILO constituents in 51 countries. A lawyer by background, studying European and economic law, Mr. Kohler joined ILO from his post as Director General at Federal Ministry of Labour and Social Affairs in Berlin, where he managed the Director General for European and International Employment and Social Policies and the European Social Fund for more than a decade. Heinz, welcome, and please go ahead.
Yeah, thank you very much for the kind introduction, and I'm really happy with the colleagues from WHO and from UNICEF to present this report. Actually, we have been coming out of a virtual global summit which took place over the last week, and which united more than 50 heads of states and governments discussing ways how to manage the COVID-19 crisis and how to manage the recovery. And I'm happy to say that one of the main issues in the entire discussion was indeed the question of social protection. So I think this presentation is also in that respect very timely. Also, it was confirmed, and Hans was mentioning it a little bit, the human-centered approach to react to this crisis is actually an absolute must. And it's also part of the ILO Centenary Declaration, which was adopted last year in the course of our 100th anniversary. What's the starting point? Like previous crises, this one has exposed the devastating consequences that prevail in the absence of a well-designed social protection system. 1. 2. The vulnerabilities of populations that have often been less visible among the 4 billion people without social protection. So I'm talking about workers without an employment contract, temporary workers, part-time workers, and workers in the informal economy. It has also shown that reliance on remittances exposes countries when shocks strike. And lastly, the highly uneven effect of shocks exacerbating existing inequalities. In other words, poor people cannot avoid crisis, whereas people are better off when they have means at their disposal. Social protection has been an important part of the crisis response, as I mentioned already, in many countries. This report actually presents and illustrates what kind of measures countries have taken to respond to it. So it means guarantee access to quality healthcare, support the business continuity through deferment of social security contribution and taxes, ensure income security of workers through sickness benefits and unemployment benefits, enhance income security through cash transfers, protect informal workers, ensure the protection of jobs, income and decent work, and finally, coordinate social protection and employment policies for a sustainable recovery so that a cliff fall scenario is avoided, whereby support stops abruptly and prematurely before the crisis is exited. I completely agree with Hans that health and other measures should go together. It's not an against. That's absolutely correct. Since the ILO is the only tripartite organization in the UN system, I also would like to emphasize the importance of tripartite dialogue to actually come to quick and effective responses to mitigate the impact of social and economic shocks. In addition to ensuring an adequate emergency response, it is necessary to develop not only a short-term but also a longer-term strategy for strengthening social protection system and increasing crisis preparedness. That's really the lesson which we need to learn. We cannot start with each crisis anew to think about short-term, medium and long-term measures. It's now the time to think about it. So resource mobilization is obviously key in that regard. At the national level, we have a wide range of options. Also, the choices are more limited in the short term since some measures need more time to take effect, like increasing tax or the contribution base. At the international level, efforts need to be sustained beyond emergency grants and loans to build universal social protection systems. I'm happy to report back that one of the discussions during the global leaders was really to have a global social protection fund established. So I hope this initiative will fly and it will fly high. At both levels, national and international, we need to make sure that all decisions on resources allocations should be guided by international agreed social security standards and principles like the ILO Convention 102 on social protection floors. Just very briefly, we have been working quite actively in the region already. The ILO is currently preparing assessments of the social protection responses to COVID-19 in Central and Eastern Europe, and we have actually established a dedicated database where we have recorded all the measures of governments and social partners taken in that respect. The ILO is also working on rapid labor market assessments in a dozen countries in Europe, starting from the Western Balkans, actually together with the EBRD, to analyze what kind of consequences need to be taken. We have already reports, for instance, in North Macedonia and Montenegro with concrete measures from those governments to close gaps in the social protection. I think that's very important to have these very concrete measures. We are also looking at rapid labor market assessment in Kyrgyzstan and Armenia and in Tajikistan as well. Also, in collaboration with colleagues from UNICEF and UNDP, we are designing shock-responsive national protection strategies in Uzbekistan. The overall message, though, is very clear. The existing social protection systems continue to play a crucial role in response to the COVID-19 crisis, but also it revealed their limitations. The crisis has really underlined the importance of proactive investment to build a comprehensive and shock-resilient social protection system, which provide optimal links between non-contributory and contributory programs and access to health and social care services. We must seize the momentum provided by the COVID-19 wake-up call to accelerate building universal social protection system, including floors. Finally, and there we need a change of mentality. Efficient social protection system should no longer be considered as a mere cost, but rather as investments. Investments acting as crucial macroeconomic stabilizers in times of crisis and beyond. I have to say the massive stimulus packages in the region are a very good signal on the way forward, and it's certainly a different policy than the 2008-2009 measures which were governed by austerity and financial consolidation measures. I think that's the good news, and therefore we should really try to take it forward in our region on this basis. Thank you very much.
Sorry, thank you very much for that, Heinz. And I think that what you're highlighting is that similar to what Hans was saying, that this now is the time where we have to really get really serious about these social and health policies as actually essential stabilizers of inclusive societies, of a well-being economy, of being able to build back better. So thank you for bringing those points forward and reinforcing. What I'd like to do now is to invite Ashfan Khan, who is the current Regional Director for Europe and Asia and Central Asia for UNICEF, for her intervention. But maybe a few words beforehand. As well as being Regional Director, she's also the Special Coordinator for Refugee and Migrant Response in Europe, based in Geneva. She's got a background training in public policy and political science with more than 30 years experience as a public servant. And maybe just to highlight some of those key things, and we see across the leaders of the three organisations a strong link to practice and field work. So Ashfan has extensive field experience, including assignments in Kenya, Mozambique, the Democratic Republic of Congo, and Colombia. She's got very broad UN-wide experience with, for example, the Interagency Standing Committee for Humanitarian Affairs and with the UN Development Group. She took time out from the UN between 2012 and 2014, where she became the CEO for Women International. And in that role, she was particularly responsible for setting the strategic vision and for mobilizing necessary resources for women rebuilding their lives after war. So, Ashfan, could I introduce you and ask you to make your intervention?
Thank you very much, Chris. And I'm really pleased to join my colleagues, Hans Klug and Heinz Kohler today. And I think first and foremost, I want to start by acknowledging the great collaboration between WHO, ILO, and UNICEF through the Regional Issue-Based Coalition on Social Protection. For me, this is an example of how UN reform can deliver better and support results that you as country teams are critical to deliver. So that joined up approach between regional and country to strengthen capacity in order to deliver more effective programs is a critical part of what we're trying to do together. For UNICEF, children continue to be largely spared from the health consequences of the pandemic, but they remain highly vulnerable to the socioeconomic impacts, with potentially devastating effects on their well-being and their futures. While all children of all ages are being affected, the most damaging effects will be concentrated among children who are already socially excluded and marginalized. The containment measures necessary to curb the spread of the virus have disrupted families' ability to generate livelihoods and their access to services. And that access to services being curtailed is important both for the areas of health, immunization, public health, and social protection. The pandemic is reversing gains made towards achieving the SDG goals. The economic fallout of the pandemic is being felt most acutely by some groups than others. This is especially true of minorities, refugees and migrants, and those with disabilities. With informal and precarious employment dominant across the region, families, particularly low income and vulnerable families, are at higher risk of job upheaval and income loss, plunging thousands of families into or deeper into poverty. Additionally, those in informal precarious employment do not have access to contributory social protection schemes like Heinz described. Like unemployment insurance, often leaving them without vital income support. UNICEF and Save the Children estimated that child poverty in 21 countries of UNICEF's Europe and Central Asia region could increase by as much as 44% as a result of the COVID crisis. We also know that unprecedented school closures, and many of you as parents have faced that, have left millions of children out of school. So this is not only a learning crisis, but also food security. Our colleagues from WFP show that over 10 million children in the region are missing school meals. The loss of free or subsidized school meals can increase food-related financial burdens at a time when families are under increased economic stress, potentially forcing families to turn to negative coping mechanisms, such as food rationing, skipping meals, or foregoing other critical expenses. And that'll have an impact on nutrition and longer term on maternal health as well. Lockdown measures are putting children and women at a heightened risk of social inclusion and maltreatment. So there is also a crisis of domestic violence. Much needed social services are becoming overburdened, and they're in need of finding new ways to operate in order to reach vulnerable and at-risk groups. All of these issues have both short-term and long-term consequences for children. Their physical, mental, and emotional development, and socioeconomic development of the societies they live in. Evidence demonstrates that social protection measures, including social insurance, social assistance, expanded services, can help reduce poverty, inequality, and childhood deprivation, and has long-term positive impacts on human capital development. So these measures have and continue to be central for protecting children and their families in the face of crisis. And that's why I was so encouraged by Heinz and the whole idea of a strengthened social protection commitment by governments in the region. The new policy paper illustrates several examples of government quick action to temporarily scale up different national social protection measures. We have seen how social assistance programs in a number of countries have been able to expand, absorbing really vulnerable households and providing existing beneficiaries with additional funds on top of their regular transfers. However, gaps in national systems are creating challenges for reaching those in need. Large numbers of people across the region are not by existing social protection programs because they're informally employed, not registered, or ineligible due to administrative reasons. And for migrants and refugees, this becomes a critical problem. In short, while governments and partners are working to address these issues and ensure rapid support is provided to those affected and unprotected, as we look towards recovery, it's essential we redouble our efforts to strengthen the underlying system, to ensure, as others have said, that they are comprehensive, responsive to shock, and sustainable to reach vulnerable and affected families consistently. When systems are comprehensive and robust, supported by integrated data management systems, so very good that ILO is helping support these, sufficient staff, and a variety of well-funded programs that are informed by and understanding of risks, shocks and stressors countries typically face, are more easily and quickly able to identify those in need and link them to the services they require. I also think, as Heinz said, and Hans both, investing in preparedness is also key when crisis hits, so they can swiftly scale up to meet the new demand. Investing in preparedness will involve incorporating a focus on vulnerability to shocks in program design, such as including vulnerability criteria, routine targeting content, and strengthening links to disaster risk management and adopting contingent measures. For instance, putting in place standard operating procedures that can be used for rapid scale-up. Governments and the international community need to recommit to the SDGs, particularly SDG 1, and the implementation of nationally appropriate social protection systems, including social protection scores, to ensure that all people across the life cycle receive coverage before, during, and after the crisis. One policy option to governments, which should be considered as part of the basket of responses, is universal child benefits. And this is a critical area that ILO and UNICEF will be working on with governments together. A handful of countries in the region are currently providing universal child benefits, either covering the children under age of 18 or a subset of children, particularly those in the earliest years. Universal child benefits are a simple and proven tool for investing in child development and shielding children from intergenerational poverty. They can also serve as an acceptable means to extend support to affected households in times of crisis and minimize the negative effects of this crisis on children. So UNICEF see very clear building blocks with many of the UN partners on the call, ILO, WHO, UNDP, to name a few. But this integrated approach, guided through the RC and working alongside government systems, are going to be a critical element for a sustainable response. We also mustn't forget the investment opportunities that come with the IFIs and a strong partnership with them in the region so that the policy and public expenditure elements are aligned. It's going to be critical. So with that, I'll end my remarks and really know that we're counting on the country teams effectively to help deliver this agenda. So your questions and your issues will be very important for us to address. Thank you.
Thank you very much, Ashfan. And I think that what you've highlighted there is that the current crisis doesn't just have a direct impact, it has widespread indirect impact on families, communities and wider society. And I think this is something for us to keep in mind. I'd like to thank all of our 3 RDs, Ashfan, Heinz and Hans, and just maybe one common reflection across all of those, that as in the report and as has been shared, we've got existing mechanisms that we can use and we've got good tools and knowledge about what to do. But what this shows us is that we've got a greater chance of achieving that now if we act together and if we do that in dialogue with different partners, but also dialogue with those people who are directly and most hard affected. So on that basis, I'd like to thank our RDs. I know that due to other commitments, they won't necessarily be able to stay right until the end. If there are questions, then we'll pick them up in the chat and we'll come back and answer those later. So now I'd like to actually move on to the second part of today's session, which is a chance to get to grips with what's in the report, question and answers with expert panels and a discussion. And my colleague Mona from DCO is going to chair this next part of the session. So I'm going to hand over to Mona, who's going to introduce the expert panel. Mona.
Thank you so much, Chris, and good afternoon to everyone. So first, just a few practicalities. So we will be taking a couple of questions at a time. So please, you can either raise your hand. You see there's a small panel with a hand that you can press on to raise your hand, and you will be invited to speak. But you can also put a question in the chat box, and we will put it up from there. So to lower your hand again, you just push on the same button. And if we don't manage to cover all the questions, the IBC have promised to collect them and provide a follow-up after as well. But let me start to introduce the expert panel. We have a very strong panel here to answer any of your questions that you might have. So first we have Kenichi Hirosu. He's the Senior Social Protection Specialist from ILO in Budapest, with a focus on East Europe, being responsible for social security, in particular in terms of pension reform, but also occupational safety and health. So Kenichi, you can also open your video so people can see you. Then we have Luisa Lippi, the Social Protection Specialist for UNICEF Regional Office, who worked in the field of social protection for the past 10 years. Her work is focused on strengthening social protection system with a particular focus on social assistance programs for children and families. We also have Jasmina Papa, the social protection specialist from ILO office, regional office as well, focused on the CIS countries. She has a special focus on social protection system design and delivery mechanism, but also about integration with social services and employment policies. And last but definitely not least, we have Sarah Thompson, the Senior Health Financing Specialist at the WHO office in Barcelona, working on comparative health system analysis and support to high and middle income countries in the European region. So we have a very strong panel who will be able to answer your questions and queries. So with that, I would like to open the floor for questions. So just raise your hand and you will be invited to speak. When you are invited to speak, please just unmute yourself and address the panel. So I see we already have one. Lower the hand again. So can I invite, I'm sorry for the pronunciation of the name here, Abdurazakova, can I say that? Please unmute yourself and ask your question.
Hello, can you hear me?
Yes, we can hear you well. Go ahead.
Yes. Congratulations with the production of this policy brief. I'm sure it will be received very well across the region, because 2 days ago we had a webinar, Food and Agriculture Organization of the United Nations hosted a webinar on social protection measures on response to COVID-19. We had about 200, even more participants with representatives of the government, civil society, and there was a lot of interest to do kind of inventory of what is happening in the region, what measures are working, what is their actual impact. So with that, I think this policy brief will very much help to close the gap. But what is the dissemination strategy for this document? How you intend to proceed with that? I will be very keen to hear about this. And a small remark, I took a quick glance at the Russian language version. I think it needs a very good editing. I hope if there will be time to do that. Thank you.
Thank you so much for the comment and question. I think I will actually going to forward that question on the dissemination strategy to Chris. But meanwhile, let us see if there's anyone else who wants to ask a question to the panel. Let me see. We have, so David Shibanta, please unmute yourself and go ahead.
Thank you. Thank you very much. This is really excellent. I work with UNAIDS in Geneva, and I have one question. How does the policy also speak to the needs of people living with HIV? And also those that are at risk of HIV, for example, sex workers, because what we are hearing from our constituents is that many people living with HIV, now some of them are not able to work. And at the same time, they do not qualify to access the social protection benefits. That's for people living with HIV. And as a result, many of them are having difficulties to stay on their treatment. For sex workers, they can't earn a livelihood and they can't access social protection services. So how does the policy speak to these two population groups? Thank you.
Thank you so much, David. When you have asked the questions, you can also lower the hand by clicking the same one. So any more questions before we turn over to the panel? Okay, so meanwhile we ask the panel, you can think about other questions as well. So maybe, Chris, can you first talk a bit about the dissemination strategy? And then in terms of how it speaks to HIV and people at risk of HIV, I don't know, maybe if Louisa or Sarah would like to add something on that one particularly, but Chris, over to you.
Thanks, Mona. It's a good question. It's the actual publication is something that we intend for each of the agencies, both together and individually as part of their ongoing work, to be integrating the findings, the recommendations and the example into both the guidance and the direct support to countries in terms of either working with governments or working directly with communities and in the case of WHO, ministries of health, hospitals, healthcare providers. So we see it being a very practical tool, and it's been written in such a way that it's not meant to sit on somebody's shelf, but it's easily digestible and will be taken and used in that way in the development of guidance and the development of analysis for building back better. I don't know whether other colleagues because this has been a team effort from ILO and UNICEF would like to add anything particular from their points on how are they going to use it. If not, we could maybe go to the next question and give Ian, Louisa and David a chance to connect.
Let's do so. So in terms of the other question, I don't know, Louisa or Sarah, can any one of you speak to that a bit?
Hi, this is Louisa, the social policy specialist from UNICEF. In terms of how the policy paper speaks to the two vulnerable populations, people living with HIV and how sex workers can be protected, I think that you can, reading through the paper, they're not specifically mentioned, but you can draw a lot of lessons learned from the different examples that are there. For instance, the coverage of sex workers and other people in informal and precarious employment has been indeed a big challenge in the region as part of the response. How do we extend benefits to these populations who aren't registered in any systems as formal workers, but also are above the threshold, the poverty threshold to apply to receive a lot of the social assistance benefits. So I think looking at some of the different examples of how countries are going about extending benefits to informal workers, sex workers could also be covered in those approaches. So Georgia, for example, is looking at increasing the threshold for which you can apply for the TSA benefits. Armenia is also exploring different ways to include informal workers into their systems. So I think maybe also someone from the ILO, maybe Yasmina or Ken, would also maybe be able to speak to how informal people who are informally employed can be protected. And then in terms of maybe access to antiviral medications, maybe someone from the ILO or from WHO can speak to that in terms of universal health coverage.
Thank you so much, Louisa. Ken or Jasmina, anyone wants to come in?
Hi, this is Yasmina, social protection specialist for ILO in eastern part of Europe and CIS countries. This is a very good question related to the position and benefit.
Jasmina, I think you're breaking up a bit.
And it is related also. Okay.
So now
sorry.
We can hear you. Can you please continue again? Yes.
Okay, sorry. So it is a very pertinent question, and when it comes to the issue of sex workers in particularly CIS region, this is something that is connected with stigma and quite a lot of marginalization. So I think in order for these people to be able to apply for any of the existing benefits for informal workers, it will be rather difficult if they disclosed their occupation actually. And additional effort here will be needed in order to help them access both social protection benefits, but also medicine. Thank you.
Thank you, Jasmina. Sarah, would you like to add anything from the health aspects?
Yes, hi, good afternoon, everybody. I hope you can hear me. 2 points. One is very specific and one is broader. On the issue of access to health services, and in the case of HIV patients, access to medicines, WHO has been very clear that it's very, very important to prioritize removing financial barriers to access to health services. Also, in the current crisis, we know that people have been frightened of accessing services because of the risk of infection. So actions to make sure that health services are secure and there is good communication about the safety of people accessing services is really important. But as the crisis goes on and the economic shock really begins to bite, I think that's when the messages about removing and reducing financial barriers to access and financial hardship for patients is going to become really increasingly important as health budgets come under pressure. And one of the key lessons that we learned from the previous economic crisis was that it was very, very important to protect spending on health and not to shift costs onto households, and particularly not onto the most vulnerable households through user charges or reductions in benefits or increased waiting times, for example. I have a broader point, which I think is very important, and that's that we really need to take this opportunity to redesign our systems of social protection, including health coverage. The systems that we have in many countries, and I speak about the health sector here, the systems of health coverage that we have in many countries in this region do not reflect the needs of the current situation and the needs that we will see in the coming years. Many of them, and I'm thinking particularly of social health insurance here, where entitlement access to health services is dependent on people paying contributions. This is a model that came from the 19th century. It's a model that was built around formal employment. It, by design, excludes many people in the informal sector, people in precarious jobs, sex workers, and others. So we really need to think not about the past, but redesigning these systems to remove these systematic exclusions from the system so that we have a social protection and a health coverage system that really works for the needs of today. And this really means moving to universal entitlements. Over.
Thank you so much, Sarah, for that. Let's move on to the next set of questions. So we have, first we're going to have Dorota Sienkiewicz and then Elena Danilova-Cross. Dorota, please go ahead and unmute yourself.
Yes, good afternoon. Can you hear me?
We can hear you well.
Fantastic. Yes, good afternoon. So my name is Dorota Sienkiewicz and I work for EuroHealthNet. So I'm calling in from Brussels in Belgium, and actually very nicely linking to the intervention just made by Sarah. When we talk about a need to redefine and reform the healthcare systems, and without here excluding the other parts of the region that I realized the paper covers, I'm just wondering how the messages that the paper outlines actually feed into the work that we are seeing now at the EU level. I'm just wondering how this can be aligned better with the directions or the messages that are coming from the EU level towards the national governments with regards to the reforms needed in these times coming out of the pandemic and the need to recover and all those things. So I'm just wondering whether you could kind of elaborate a little bit on that. Thank you.
Thank you so much, Dorota. That's a very, very important question to look into, how we can actually make this bigger than just the paper that's been produced here as well. Elena, please go ahead and unmute yourself.
Thank you very much. Good morning, good afternoon, good evening, colleagues. First of all, congratulations with this very thoughtful paper. I'm from UNDP, Istanbul Regional Hub, from the team of Sustainable Development. My question is related to the definition of leaving no one behind. It's in your title, and it mentioned once on the second page of the publication. But it still remains a mystery to me of who we call those who are left behind. The most classical approach is to go by groups of population, disabled, poor, vulnerable, but we more than before understand that these deprivations people are facing are multidimensional. So is there any thought in your new approach to social protection in Europe and in Central Asia to see this or to recognize this multidimensionality in targeting social protection to people who face them in different groups? Thank you.
Thank you so much for that question as well. I also want to give the floor to Afshan before we turn back to the panel. Afshan, please go ahead.
Yeah, no, I just wanted to come into this issue on Europe and just say that I think there's some important initiative ongoing within the European Union that UNICEF and other agencies that have a broader remit are looking at, and that includes partnerships on a child guarantee for vulnerable households, and it also addresses the last point raised by UNDP in that there's certain population groups that may need to have specifically targeted interventions, hence the universal child benefit. And I think we have to recognize those as key instruments for the multi-generational poverty issue. So I do think the IBC coalition's partnerships with other entities beyond UN agencies and looking at external partnerships will be an important element of the rollout of this document. Over.
Thank you so much, Afshan. So in terms of that first question, in terms of alignment to other reforms needed and the member states here, anyone else from the expert panel who wants to add to what Afshan just mentioned?
Can you hear me?
Yes,
Mona,
now I
this
hear
is
you,
Chris
Chris.
here. Maybe I would like to just make a comment there. I think on the EU level, I think that we're seeing some changes. It's a really good question, Dorota, because we also know that the kind of frameworks that the EU gives influences the priorities, the investments, and the degree of freedom of movement to implement what's these practicalities. But I think there's also been a shift at that level as well. And so I think that some of that thinking at the EU level is still going on. 2 weeks ago, there was a meeting of the RDs of all the UN agencies in Europe and Central Asia with the EU. And the top priority that came up both from UN country teams, WRs, the different UN agencies and EU was social protection. Obviously, there's an issue there about looking at the financing and the models, but as we've seen today, there's a shift, and I think we need to grab that opportunity of the shift and put forward some very clearly what are both the practical solutions in this report and the fundamental messages around them. And we know that organisations like EuroHealthNet are very good health and health equity advocates. So we look to working in collaboration with you to push that agenda forward. If I could also make a comment back to the colleague on the multidimensional, it's really key this for building back better. Essentially, some of the problems in the past have been that our systems, our health and social protection systems, have been in silos. And we know that right now we're seeing segments of the population who are living with and are likely to be living with, if we don't intervene, with multiple insecurities: health, job, income, future prospects, safety. And I think that these kind of flaws that we're talking about for health and social protection and new ways of putting that in practice. So, for example, last year WHO launched a publication looking at how would we really tackle the multidimensional nature of health inequalities that arise from social and economic risks and consequences. And that was on universal basic income, and how universal basic income policies do exactly what you're saying. They provide the foundation upon which the others rest. And I think that we're seeing a lot more interest to look at this, and instead of trying to look at projects and target groups, but to create the basis of a fairer society. and look at the policies that will enable us to achieve that. So that would be my kind of reflections on that comment. Thank you.
Thank you, Chris. I mean, maybe I can invite Ken as well to give a bit of a perspective. I mean, from your experience, I mean, working as well, both with pension reforms, but also in terms of, you know, employment, livelihoods, and so on. So, as we spoke about, you know, multidimensional approaches to leaving no one behind. So, how does ILO look at this?
Yes, I mean, rather than ILO, so I mean, the social protection is quite a wide range of scope. So let me focus on those group in the active age or retired, and let me focus on income side rather than health. This is my personal, but I mean, this leaving no one behind is a very strong statement. But we look at as a kind of overreaching slogan. I mean, to reach to that. And when we deal with this multidimensional, I think well, in the region I'm covering in the Central and Eastern Europe, I think the contributory system still covers majority of population, and it really works as a automatic stabilizer in terms of unemployment, in terms of continuation of the job. However, this, as my colleague already mentioned, the increasing number of informal economy and so-called non-standard form of employment are really the big concern, which I think represents, depending on the country, 30 to 40% of the labor force. The issue of whether we should, so this non contributory social assistance, the balance between the contributory and the non-contributory is important. And now the issue that they're talking about was there's a big issue about this targeting or universal. This one, I think it's a big debate. So I not in a I cannot say which we should position on. I mean, obviously we lean towards this universal, but the this proposal of basic unconditional basic income. In terms of health, as the WHO colleague said, this might also make sense, but we have to also think about this revenue policy as well. State has a constitutional obligation to protect the citizens, yes. But then for that, the state has also the right to tax. But they are heavily indebted. Many of the countries are heavily indebted, and they rely on this international financial institutions. So in that situation, the double binding situation, how we can provide that, and also in that situation, the wage payroll has been traditionally an important tax source. Whether we should completely give up and then go to some other shifting some other tax like a VAT or some corporate tax, that I think we need a serious consideration to that. So in terms of let alone the health, but in terms of the income, I think there is still many open problem to be solved. Thank you. I stop that.
Thank you so much, Ken. Is there anyone else from the panel who wants to add anything to this question before we move on?
Mona, yes, this is Yasmina, and I would like to refer to the issue of definition of vulnerability and leaving no one behind. In my view, the policy brief speaks to the universality, and it talks about the fact that all of us are vulnerable in phases of crisis. Not all of us, most of us are, most of the people are vulnerable in the face of crisis. And when it comes to the issues of those who are furthest behind, we see that many countries in the sub-region have long time been concerned about definition of who those people are. And these definitions in many ways have been somewhat static. We need to consider that people should be able to move from one quote-unquote status to another, and that social protection policies and systems are there to support them when moving from different positions of vulnerability or being at risk of poverty or vulnerability or not being in the risk. So in my view, reading between the lines of the policy brief, those furthest left behind are really coming clearly across in this brief. Workers in informal economy, in precarious work, families where those who are earning in informal economy, the persons with disabilities are also listed there. The brief in itself takes a view which is more on a structural level than in definition of different groups and focusing only on different groups. And this is positive because if we focus only on different groups, we risk that the system-wide response is going to concentrate on the groups themselves rather than look at the comprehensiveness of the system. And we now need to look at the comprehensiveness of the system, the integration of contributory and non-contributory financing options, integration between services and cash benefits and access to labor markets, and actually creation of the continuum of these services that are able to be flexible and respond quickly to different types of risks and vulnerabilities. Thank you.
Thank you so much, Jasmina. Is there any other questions? I don't have any new hands raised at the moment, but please go ahead and raise your hand if there are more questions. Okay, I mean, if not, actually, from the IBC side, maybe we would like to pose a question back to the participants here as well, because in the participants we have a number of country team members, but also different types of sets of RCs. So, so beyond the publication that the IBC now has, produced and shared around with you, I mean, what are the key asks from the country teams in terms of the support from an issue-based coalition to support you at the country level, working on social protection in the face of COVID? Do you have any specific asks of the IBC that you would like to raise as well here today? I'm seeing a lowering of hands, but not adding it. Let's see. Someone just raised their hand. So was it you, Jasmina? Jasmina, did you want to speak again?
No, sorry. I think I forgot to lower my hand.
No problems at all. Anyone else who has questions or would like to contribute?
May I?
Yes, please go ahead.
This is Dono. Yes. Getting back to the question that I asked about dissemination, I think that this paper might be a very good opportunity for awareness raising in the region, and I think IBC should think about that. But I think we need to be very clear in our messages, and the point on universality and comprehensiveness is extremely important, but at the same time, we need to keep in mind, and this came up very clearly, that there are groups that are at risk of being left behind, even with the universal coverage. And for example, the discussion we had 2 days ago, it raised issues in relation of social protection, food security, access to food and nutrition in this situation, and the issues related to groups living in remote areas, for example. And we discussed about informality, sex workers were mentioned, but there is a far bigger group of agricultural workers that are informal workers in the region. And they are the ones who are very much suffering these days, especially from mobility restrictions and overall higher poverty rates in rural areas. So these are the issues that needs to be taken into account very clearly, and in the message that we would like to go out of the issue-based coalition. Thanks.
Yes, thank you very much. I see, Ken, you also have your hand up. Do you want to comment on that?
Yes, quickly. I think the uniqueness of this COVID-19 crisis is that people realize that the people's lives are more important than work. So they went on quarantine and lockdown. But then when it continues 3 months, 4 months, now the issue of how to live with your life, the livelihood is becoming an issue. So I think I think the UN group is a good forum to discuss, to marry the health sector and also the economic or development sector with different agriculture or different industrial sector, that the at what level the cost and benefit will be optimized. So when we might face the second wave of this pandemic, whether we should go for complete lockdown or we can just, completely open the economy, like, I don't know, like some countries. So, but there is in between, there should be some optimal point, which avoids the spread of infection, but still allows for some economic activities. And that's why, and of course, the social protection is important contribution to that. But I think this UN collaboration in terms of how to find the economic reopening and also while keeping the spread of infection would be a very important issue. Thank you.
Thank you, Ken. Let's just turn over to Louisa before we need to close the event as well. But Louisa, please go ahead.
Sure. I just wanted to make it a point that, the paper does call for universality across the social protection systems and programs to ensure the floor, but that doesn't mean that we're not recognizing the importance of more targeted programs on top of that. So it's not one or the other. It's not targeted programs versus universality. It's looking at ways that we can establish a universal floor that covers all people, but then also looking at ways that we can provide additional support to specifically vulnerable people. And that comes back to the point that Jasmina made earlier on integrated approaches. So ensuring that within the systems, when we do vulnerability assessments to enroll people in social assistance programs or other social protection programs, we're looking at a whole host of different vulnerabilities, and then trying to match those people up with different services and supports to ensure that they are able to live their best lives, I guess you could say, to make sure that they can participate in society, they can work, they can access a variety of services. So they're not mutually exclusive, but they're mutually reinforcing. We want to make sure that we have both integrated approaches to look at various different vulnerable groups, but also universal approaches that establish a floor for everybody. And I think that coming together through the IBC, and working with UN country teams in the different countries across the region, hopefully we can work together to look at a common definition of problems, particularly that are coming out of the COVID crisis. What are the elements that need to be strengthened within each individual country? What is the common agenda that the UN can bring to the government with the areas of support, and how we can complement each other's work, so we're not acting in necessarily competition, but we're coming in one voice, being able to leverage our specific expertise at the country level to the government to make sure that we're putting in place systems that work for everybody, and ensuring that everyone has the support that they need, specific support that they need to thrive in society. So that's up for me.
Thank you, Lisa. I think actually that was an excellent wrap up of the section for the expert panel. So thank you all of the panelists for joining, and also for all of the hard work on the report as well that has been shared. We're reaching the end of the meeting, so I'm going to hand over again to the UNICEF Regional Director, Afshan Khan, to make some closing remarks before we end. Afshan, please.
Thank you. And thank you all for the very rich discussion. The suggestions on the report, as well as on the dissemination. I think when I listened to the last set of conversations with the panelists, what made clear to me was also that this policy paper and the work you are doing as an issue-based coalition is tremendously important to feed into the socioeconomic response and recovery on COVID that UNP is helping coordinate with the SG. If we don't use effectively in a joined up way, as Louisa very nicely put, our whole of UN agency support to the government, we will be sending mixed signals. So the RC coordination role in using this report at the national level, including as a tool for developing cooperation frameworks and building on the work that's being done for socioeconomic response to COVID-19, alongside the survey work that's being done on the economic impact, the social protection element from this report and this will be critical. So I'd just like to thank WHO, in particular Chris Brown, who helped facilitate the event, and Joanna Lima for leading on the production of this report, as well as Luisa Lupi and ILO Ian Norton. And also thank panelists, Sarah Thompson from WHO, Kenichi Heroes and Yasmina Papa from ILO, and Mona Folkeson from GCO. I think this way of integrating with the team at the country level provides us a unique opportunity for the IBC to have direct dialogue with country teams. And at a time when many of us cannot travel, the opportunity to engage and provide direct support through a remote group of experts, something we can possibly expand as the development cooperation frameworks are being developed. So thanks for a great discussion and some very important feedback before we roll out the report. Thank you so much, and everyone have a great week.
Thank you so much, Afshan. Bye, everyone, and have a great day.
Thank you. Good discussion.